In this video, we'll understand what is wrist drop and why it occurs. So, in the forearm, we have two set of muscles, the flexor compartment of forearm and the extensor compartment of forearm. The flexor compartment of forearm is supplied by median nerve and anterior interosseous nerve, that is a branch of median nerve. Whereas the extensor compartment of forearm consists of following muscles: the superficial muscles, which are arranged in the lateral group and posterior group, which includes the brachioradialis, extensor carpi radialis longus and extensor carpi radialis brevis. These are three muscles of the lateral group. The posterior group among the superficial extensors are the anconeus, the extensor digitorum to extend the digit, then extensor digiti minimi to extend the little finger, extensor carpi ulnaris. So these are the four posterior group of superficial extensors. Other than this, there is three muscles: abductor pollicis longus, abducting the thumb; extensor pollicis longus, extending the distal phalanx of the thumb; extensor pollicis brevis, extending the proximal phalanx of the thumb; extensor indicis, extending the index finger; and supinator muscle, which beginning from the supinator crest of ulna, rotating the radius like this, so thereby helping in supination. These five are belonging to the deep extensor muscles of the forearm. Out of all these muscles, all of them passes the posterior surface of wrist joint except anconeus, which crosses only the elbow joint, so it extends the elbow; supinator muscle, which rotates the radius around the ulna like this, causing supination. So other than these two muscles, all the remaining muscles will cross the posterior surface of the wrist joint. So when they cross the posterior surface of wrist joint, they should cause extension of the wrist joint. These muscles are supplied by posterior interosseous nerve, a branch of radial nerve. The brachioradialis, please note, extensor carpi radialis longus is directly supplied by the radial nerve when it was there near the cubital fossa. But remaining all the muscles are supplied by deep branch of radial nerve, also called posterior interosseous nerve. So anterior compartment of forearm, median nerve and anterior interosseous nerve; posterior compartment of forearm, the radial nerve and the branch of it, which is the deep branch of radial nerve or posterior interosseous nerve. The wrist tends to be in neutral position, okay, because both these muscles are pulling to an equal extent. When the flexor muscles are pulling, it will cause flexion. When the extensor muscle is pulling more or contracting more, it will cause extension. So flexion of the wrist is controlled by median nerve, extension of the wrist is controlled by radial nerve. So if at all there is a damage to the radial nerve, either in the axilla or in the spiral groove or at the level of elbow, there is a paralysis of posterior compartment of forearm muscles, that is the extensor group of muscles. So we should not be able to extend our wrist. So the wrist should be flexed and it can be neutral, right? But actually the person will always have the wrist dropped like this and it will remain in this position. This deformity is a flexed deformity of the wrist and this is called as wrist drop. Why this occurs? Because there is a paralysis of damage to the radial nerve or posterior interosseous nerve, paralysis of extensors of forearm resulting in unable to extend the wrist, but unopposed action of the flexors of the forearm. There is nobody to oppose, so it will pull it and bring the wrist always in this position. So this is the most important point, the last point, the unopposed actions of the flexors of the forearm, because the median nerve and anterior interosseous nerve are still intact. This causes the wrist to be in flexed position. This is called as wrist drop. Imagine both median nerve and the radial nerve has been damaged. So the wrist neither gets in flexed form like this nor it can extend like this. So the wrist is completely paralyzed because both the extensors and flexors of the forearm are paralyzed. So the wrist will not be like this. The wrist will not be dropped. Neither the wrist will be extended. So it will be fully paralyzed because both group of muscles are gone. But in case of damage to radial nerve or posterior interosseous nerve, there is paralysis of extensors of forearm, unopposed action. Nobody is there to oppose. Two people are pulling the same point, wrist. One person stops pulling, the wrist will go to the opposite side because of the unopposed action of the opposite side. The flexor muscles continue to work because the median nerve is still intact. So it pulls the wrist like this and therefore wrist drop. Hope the concept of wrist drop is clear and the anatomical basis of the wrist drop is clear. Thank you. If you like the video, kindly press the like button and share this video with your other friends, and kindly subscribe to the channel. Thank you.